Roger, I'm sending in position definitely. Roger, 1-4 vehicle, 16 pack. Red 1, Blackjack 6, be advised, U.S. forces on the ground in the town.
Today, the United States Army faces an operating environment characterized by uncertainty, complexity, rapid change, and persistent conflict. In the midst of enormous risks and challenges, those in uniform must be able to trust that if they are harmed or fall ill while in the service of their country, the right medical capability will be there for them. Our nation trusts the U.S. Army Medical Department to provide the very best health care to the men and women who protect our way of life. The medic, nurse, or surgeon, and the entire Army health system that supports them will be there to save their life, restore them to health, and return them to their families.
Trust is at the core of what we do. We've got service members that have been volunteering for the last 10 years at a time when our nation's been at war. And they've done that because they believe healthcare is going to be there when they need it most. And so that trust that will be there with compassionate healthcare, trust that will be there with the right equipment, trust that will be there with the right logistics supply, it's inherent in everything that we do.
Modern military medicine relies heavily on medical materiel and logistics services that are demanded exclusively by the delivery of healthcare. The Army health system relies on medical logistics to generate and sustain medical capabilities in peace and war, and keep the trust and confidence of those depending on it the most. Simply said, healthcare starts with medical logistics.
Well, you know, I was an Army physician working in hospitals for 31 years before I came to this job. And I think I always took medical logistics pretty much for granted. I always had what I needed when I needed it. And so I never really thought about how all that happened.
When I first took command for our Ford Surgical team, they would tell me, sir, you got to learn about medical logistics. Make sure you understand it left and right. And the system worked flawlessly.
Obviously, big theater logistics have a lot of challenges to them, and you're moving a lot of volume, a lot of distance. But that last tactical mile that we deal with here in the brigade combat team is tough because you have to deal with the enemy in a very close proximity to where you're at.
Healthcare starts with medical logistics. It's not just a tagline. It's not something just to put on a coin and hand out occasionally. We really believe that.
The best physicians, the best PAs, the best medics that we've got in the world do nothing without medical logistics.
You can't do the great medicine that we're doing downrange or in our medical centers if we don't have the right equipment, if we don't have the right supplies, if the OR isn't cleaned properly. We don't provide the environment of care for that world-class clinician to do the job that they do every day. And so folks are passionate about that.
Here back in the States, we have everything to do our jobs effectively. Then we deploy, transplant to a site that has nothing. We start out with a blank desert template, and from there medical logistics helps build a hospital and a medical school and clinics that help bring life-saving care to our soldiers, NATO allies, and also local nationals.
And so the medical logistician, instead of just reacting, they're actually leaning forward in the foxhole, so to speak, in order to make sure we have what we think we're going to need on hand for us when we do need it.
It's very satisfying to know that the clinician can focus on the procedure. He doesn't have to worry about his medical supplies or the equipment because he's trusting me to provide him with exactly what he wants in a timely manner.
So what makes logistics special for me is the warfighter. That's the common denominator. That's what it's all about, is taking care of those young men and women who are over there doing their work for our country. And that's why we do what we do.
Medical materiel requirements are difficult to predict. But because human life hangs in the balance, it's imperative that the needs of the Army health system are responded to quickly and accurately.
If you look at the maintenance requirement for a vehicle, it's okay to have 25% of the vehicles in the shop because there's enough other vehicles in the motor pool to do what we need to do. But we don't want 25% of our patients in the shop waiting parts. It just doesn't work.
Army Medical Logistics has a proven track record of support to military medicine in peace and war. However, the Army and the world are changing. The Army Medical Department must be prepared to meet the medical challenges of tomorrow. Central to this transformation is the need to produce a more agile and adaptable medical force to handle a future environment characterized by uncertainty, complexity, and rapid change. This will place new demands and expectations on Army Medical Logistics. One way the AMED is responding to these new challenges is with the formation of the Army Medical Logistics Enterprise. This concept will combine Army Medlog capabilities of both generating and operating forces into an integrated enterprise network that optimizes support to meet the demands of Army medicine, the military health system, and the Joint Force Commander.
We need to decrease variance, decrease cost, and increase efficiency across all of our processes. Logistics, taking an enterprise approach, is an innovative mechanism that's going to really leverage Army medicine in its transformation process.
Working so closely with the Army Medical Logistics Enterprise is so very important to achieving those efficiencies and that effectiveness for the warfighter. In today's environment of the downsizing, of the transition that we're going through in DoD, it's never been as important.
People across the enterprise are fighting some of the same battles, and they already have a solution. So you can get at best practices, number one, and then get it spread throughout the organizations quicker than if you don't have that enterprise mindset.
The Army Medlog Enterprise harnesses the capabilities of the entire Army health system to create an operational framework for support to Army medicine. This framework is more responsive, flexible, and adaptive than the organization-based structures of the past. This enterprise approach is a natural response to Army medicine's need to align with DoD's system-wide drive toward innovation. The success of the Medlog enterprise is predicated upon 4 key supporting concepts. The first is total life cycle management. This defines the scope of Army Medical Logistics from the identification of medical materiel requirements through acquisition, fielding, and sustainment of materiel solutions.
We have MRIs on the battlefield for the first time ever. Just occurred over the last several months. Herculean logistics effort to move that into Afghanistan. Our clinicians, no matter how well they're trained, can't do their job if they don't have the right products in their hand, if the product isn't maintained properly and it's not ready to be used. So whether it's drugs, whether it's bandages, or whether it's a CT scan, healthcare starts in medical logistics so our clinicians can get to work.
Total life cycle management makes medical logistics adaptive to clinicians' requirements and ensures that the technology we field can be maintained to standard. This is no easy task.
When a piece of equipment is off, just by a little bit, a few extra drops of medicine in an hour could end up being the difference between saving somebody's life and having that patient lose their life.
Doctors, nurses, they rely so much on the equipment that when it fails, it usually takes down a patient with it.
We can do everything that we do in a hospital on the front line, right along with the warfighter. And knowing that my technicians are as highly trained as possible to be able to make sure that the equipment is safe for use is very important.
When there's equipment whose safety I've ensured is used to save somebody's life, that means I had a small part in that. And I don't think there's a greater satisfaction than knowing that you've saved somebody's life.
The second concept involves establishing an enterprise architecture so that all of the organizations within the Army's Medlog enterprise can efficiently share the same data. The Defense Medical Logistics Enterprise System now networks all strategic Medlog organizations in a single system for medical supply support to Joint Theater Medical customers.
Enterprise architecture for us while we were in theater was very important to our daily operations. We could talk to USAMSI SWA, we could talk to USAMSI in Germany, and if we needed anything on any daily basis, we could get it via this networking system, and it was fantastic.
Another key supporting concept is to re-engineer business processes and remove organizational barriers to enable the most efficient and effective customer support possible. This will require significant changes to traditional ways of doing business at the strategic and tactical unit levels.
It's transforming our business processes, our logistics processes, our personnel processes, talent management. So every aspect of what we do is being transformed to ensure that we are able to continue to provide care in a fiscally constrained environment.
The fourth supporting concept is the building of strategic partnerships among the Army Medlog Enterprise, the Defense Logistics Agency, and our sister medical services. These partnerships promote joint interoperability, facilitate commonality of business practices, and the stewardship of DoD funds.
Our partnership with the Army is really a good news story. We're working so closely together. It's really the shining example here at DLA Troop Support of how we should really manage our other supply chains as we provide support to the warfighter.
The Medlog Enterprise is transforming the Army Medical Department rapidly with one unifying goal in mind. No matter where or when the need for medical assistance arises for our warfighters, Army medicine will be there to ensure that they receive the care they deserve.
I think that the Army Medical Logistics Enterprise has come a long way, and I think we're headed in the right direction. And I think that the leadership is there to get us there.
The AMED pursuing this enterprise approach is not just right for Army medicine. I think it's right for Department of Defense, and I think they're going to be leaders of change actually for our nation.
Healthcare starts with medical logistics, and it has a primary focus: the warfighter.
Medical logistics does matter to me. It matters to the soldiers who are out there in harm's way. It matters to the providers that are going to treat them. It matters to those combat lifesavers that are there doing the initial treatment, because we know we're going to get the life-saving intervention we need at the time we need it.
At the end of the day, it's all about the patient. It's all about the man or the woman leaning forward in the foxhole on the gurney in front of us who needs our care and needs it now.